And to enter into the cranial cavity, first we have made a cut along the borders of the what you call the calvaria, and this calvaria is removed. Okay. So as we remove the calvaria, you can see the dura mater. Right. This is the tough layer, which is the dura mater. Forceps. You can see some vessels also. Can you see these vessels? These are all the vessels. This side also. Yes. These are the branches of the middle meningeal artery. Okay, which supplies to the meninges. Okay. If there is a fracture, these vessels will get ruptured, and that causes a hemorrhage between the cranial cavity and the dura mater. That hemorrhage is called as epidural hemorrhage, which is a collection of the blood between the cranial cavity and the dura mater. And what is the shape of that hemorrhage?
Lens shaped.
It's biconcave, or it's an oval or lens-shaped hematoma or hemorrhage you can see in the examination of the CT and the MRI. Now what I do is, I will cut the dura mater to see the folds of the dura mater. So I give 2 slits on either sides of the dura mater along its longitudinal way. I am extending this anteriorly towards its anterior attachments. Extend it behind also. Something like brain tissue but shrink. Now I am cutting the anterior attachment of the fox cerebri. Okay. So this is one cerebral hemisphere. This is one cerebral hemisphere. In between these two cerebral hemispheres, you are seeing this extension of this dura mater, fold of dura mater. Now I am cutting its anterior attachment of the fox cerebri, which is attached to what? It's the see, is it not sickle shape? Yes. Now this is the fox cerebri, okay, which has got an inferior free margin and a superior attached margin. Where you see along this superior border, which is convex, which is seen the dural venous sinus, which is the superior sagittal sinus, and along the inferior margin, you will see the inferior sagittal sinus. Now this is a longitudinal fissure. This is the longitudinal fissure. The tissue has got damaged. Brain tissue is not healthy. Most of the tissue has got damaged and shrinked. See, the tissue is damaged. So there is no use of studying the brain from this cadaver. We have to take in healthy brain from the dissected, already dissected brains we have. So from that I'll teach you the brain. So from